Assalamualaikum warahmatullahi wabarakatuh. Today we are going to learn about the allied health professionals, the Malaysian allied health professional, and why we need to have this Malaysian allied health profession. And also we look at a specific the AHP Act for a nutritionist. Generally we look at the background. Roughly, in Malaysia we have more than 30,000 AHP, allied health practitioners. There is remain outside of any regulatory framework. We are not like other professions. And this is a very important issues because we want to look at in terms of the safe and quality practice. We want to ensure that we have qualified and very what we call competency allied health practitioners. And somehow, when we don't have any what we call as a body, any act, and etc., the scope of practice of the allied health practitioners is not standardized. And whenever we have problems in terms of any mistakes by people, by the netizen out there, who claim they are what we call giving an advice in terms of nutrition and etc. We as a qualified nutritionist, we don't have any avenue to complain or on that substandard practice. And this is very important for us to have our own HP Act to address in terms of what we call liberalization and also globalization. In other countries, if we look at for other legislations that cover all healthcare professions, they have practices in Australia and also New Zealand. Where Australia they have their own what we call as Health Practitioner Regulation National Act 2010, and also New Zealand also in 2003 they also have what we call as Health Practitioners Competence Insurance Act. Not only that, they also have covered for a certain countries. They covered a certain what we call a few healthcare professions, which are from the United Kingdom. They have the health professions order 2001, as well as in Singapore, our neighbor. They also have Allied Health Profession Act. They also have their own AHP Act in 2011. So we can see that actually this in Malaysia we need this kind of act in order to protect our professions as a allied health professions. So this is all the profession in Malaysia. We can say almost of the medical professions, they have their own act regulations, they have their own regulatory body, and they have their own certification. So we as allied health professionals, for example, as a nutritionist, we also want our professions to be protected. Okay? For example, we know the MMC, Malaysian Medical Council, which is this body is a regular body for the medical officer. We have dentists, we have nurses, they have their own board, Malaysian Nursing Board. We have midwife, Malaysian Midwife Board, and we have the Malaysian Pharmacy Board, and etc. And Alhamdulillah, in 2016, okay, the Parliament already endorsed our allied health professions, where these allied health professions is under Act and Regulation of Allied Health Professions Act 2016. Okay, it's just recently 3 years ago in Act of 774, and our regulatory body is Malaysian Allied Health Profession Council. Actually, to have our own AHP, Allied Health Profession Act, is not an easy task. Actually, we are started back in 1987, where we have our own idea to come out with the AHP Act that is mooted by the profession. And it took many years until in 2010, the Director General approved the one that the idea came up in long time ago. And in 2013, okay, the draft of this act was endorsed by the ministry, and Alhamdulillah, 3 years after that, this act is gazetted on. This is the day that we always remember, which is the 18th February 2016, where our own Life Health Profession Act has been gazetted by the Parliament in order for us to practice this, our own ACTA as a Life Health professions, where it covers the more than 30,000 allied health professionals is not under any protected, any what we call a regular body before this. So basically, this is the law, the Act 774, where in this Act they have 8 parts. They have the second part, the second schedule is on the Malaysian Allied Health Professional Council, and then they have Allied Health Professionals registration in terms of disciplinary proceeding, offences, enforcement, and also interior general. There are 46 sessions and they have 2 schedules. And under the 2 schedules, it covers about 23 professions. And nutritionist is part of that 23 professions. So we have to know what is actually profession of allied health and what is actually allied health profession. Okay. Profession of allied health, it means any profession which has a direct or indirect effect on patient care or on the health of individual or the populations. But AHP, allied health profession, means the profession of allied health specified in the second schedule. Okay, what is the second schedule? We look at after this. And any activity that relate to allied health prescribed by regulations under section 2. So this is allied health professions. So under the second schedule, there are the 23 professions that are covered under the AHP Act, starting with the audiologists and also with the speech language therapists. And we can see here, okay, nutrition is also part of this what we call allied health professions. So this is all the function, the membership, the AHP, the qualify and the competence of competent of the HP and etc. But for the purpose of this topic, we will look at in terms of a nutritionist. Okay, a nutritionist. So we look at in terms of who is nutritionist and what is our scope of practice and what are the practicing certificate, what is the requirements to be a nutritionist in Malaysia, what are the requirements if you are non-Malaysian, and how to renew your certificate. And there is a special part in this. As a nutritionist, we have what we call also in the section 46 on the X, which is on a grandfather clause. What is a grandfather clause? We will look at after this. Okay. Why we need, as mentioned earlier, why we need this act? Okay, because there's a lot of nutritionists nowadays in the media social, and to regulate the nutrition practice in the country is very essential. It's very important because we want to ensure that the one that we practice in terms of nutrition is only by the qualified nutritionists. Okay, that comply with the profession standard. And this act is served to ensure that all of us, once we registered with the AHP, okay, we undertake our roles and functions within the scope. We look at there are about 13 scope of nutritionists. So we have to practice. We have to undertake our role within the scope of a practice, and also we need to full adherence to the standards of the Act. And they have their own council, and this own council will take appropriate actions against those who contravene the regulations of the Act. this is the definition of nutritionist. If people ask who is nutritionist, is what is nutritionist. Okay, so nutritionist is of course an individual which we is trained and also we registered as a nutritionist to promote. This is our job. So as a nutritionist, you have to promote the nutritional well-being of the individual or population, individual and population, as well as we need to prevent and control nutrition-related diseases. This is our scope, to prevent and control nutrition-related diseases of various target groups at different settings, at different levels, through policies and regulations, education, training, assessment, and monitor the nutritional status. We carry out intervention, we do the consultancy, and also we do research and development. This is nutritionist. And we will look at, after this, the 13th scope of nutritionist. As I mentioned in the definition of nutritionist, our job, you have to know how to talk, you have to know how to communicate, because majority of our job or our scope is to promote nutritional well-being of communities and population groups. So you have to know how to communicate, you have to know how to talk, because this is our scope as a nutritionist. And what is the difference between nutritionist and dietitian? We as a nutritionist, we are more on the what we call as prevention. We prevent people from getting diseases. We prevent people from getting obese. We prevent people from getting all non-communicable diseases. And also as a nutritionist, we control all those nutrition-related diseases at various groups and also at different settings, in school settings, in the village settings, in whatever settings, and at every levels of the community. This is our scope as a nutritionist. We assess, we monitor, we evaluate the nutrition status. We know how to measure the weight, we know how to calculate the BMI, we know how to do the waist circumference, we know how to assess the physical activity, and etc. So this is also part of the nutritionist job, okay? And also at communities and also population groups. Next, as a nutritionist, we provide input for the development and implementation of nutrition and related policies and action plans. So we on our first class, we learned about NPAM. We learned about the national policy, National Nutrition Policy (NNP). We learned about MDGs, Malaysian Dietary Guideline. We look at in terms of the R&R, the recommended dietary intake formulation. This is part also job as a nutritionist, where we provide the development of the policies. That's why you learn about nutrition policies and also food security discourse. Okay. Number 5, undertake and support the R&D, the research, and communicate findings at various levels. You have to know how to conduct research as a nutritionist. Next, develop and also you have to know how to develop a nutrition intervention program. After you develop, you implement the program, and after you implement the program, you evaluate the nutrition program. You have to do back on the scope number 1 just now. You have to do to promote the well-being of the population. Next, number 7, the scope of nutritionist is to undertake capacity building in nutrition through education and training. We have to coordinate and carry out multi-sectoral nutrition activities and program, get collaborations with the people out there, get collaborations from the private sector, from the health company, from the many sectors in order to come out, in order to promote nutritional well-being of the Malaysian population. Next is to provide guidance on nutrition aspects of the formulation and development of products and services. When you work at the what we call at the